What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we are covering why do a lot of healthcare workers who work at the hospital wear backpacks. So to give you context, my credentials, I am an X-ray tech. I've been doing it for 4 years. I do night shift and I work a lot of OT, so I do dabble in day shift. So to give you context, a lot of people, you see healthcare workers, they got a little backpack. So the most simplest why, I didn't understand it. I mean, when I was going to clinicals, I always wondered why. I was like, oh, most people just wear backpacks because, you know, the school learning and all that, that's kind of usually where you ended up seeing people wear backpacks. So what has happened is I literally quickly noticed that so much stuff happens at the hospital. And a lot of people spend a lot of time, usually between 8, 12, sometimes 16 hours. If you're a resident, probably even more. Doctors, Lord knows how many hours they spend up there. But for us regular folks, the nurses, X-ray techs, whatever, 12 is usually about the most. Sometimes you can push the max you legally, it's like 16, but whatever. So you have a few situations. Some people take extra scrubs, especially if you work in the emergency room like I do. You never know, blood, foreign object, get ripped, anything can literally happen to your scrubs. And what's gonna end up happening is most likely you're gonna end up with some OR scrubs or them little paper clothes stuff they give to the psych people if you don't have an extra pair. So some people do that. Other people bring like their little phone chargers, bring like I have in my backpack, I have my phone charger, I have some pain medicine, like headache and like some basic stuff like that. I have a bunch of my equipment I bring for work, which that's kind of subjective depending on what you endeavor in at work. Like keyboards and mouse and stuff like that. Just there's optional stuff to make my job easier. And then my pair of scrubs, which I usually just leave it in the car, my pair of scrubs, because it's not really, I rarely would. I mean, the 4 years I've been working at the hospital, I've only had to maybe use one time, switch out my pair of scrubs. Some people put their food, stuff like that in there. Other people extra pens, markers, and stuff like that. I have a little mini X-ray tech book, which that one only gets used for special exams, the ones that rarely we do at the hospital where I work at. Majority of the skull, facial bones, all the heads go to CAT scan, but occasionally for little kids, we will do them. I rarely do them on top of my head. I mean, I know the general sense. Like, if they order a skull, it's going to be AP and lat. And then, I mean, I know the positionings, I just don't know the protocol sometimes. And I know with certain ones, you have to, like, if you shoot it and then the patient isn't able to, like, adjust their head, like the peaches ridges doesn't fall in certain areas or whatever, you have to adjust the angle and stuff like that. So little things like that. I carry my little Bontrager book, the mini one. So I have that in my backpack. I've seen people carry like little coffee stuff and like protein powders and stuff like that. Essentially like a mini camping on the go. If something happens, you kind of need situation. I've seen that a lot of time. Other people carry extra clothes so they change and they go to work or go do whatever they have to do. It is useful carrying a little backpack because you never know what awaits for you. And yeah, it's been your boy Miguel. See you on the next one.